I'm Harold Bennett, holding a 1991 Time cover of Drive. Bernadine Healy. The headline warns of Yentl syndrome, meaning women must act like men to be diagnosed correctly. 34 years later, heart attack symptoms in women still steal an American woman every 80 seconds. If a doctor has ever waved away your shoulder pain or nausea as just indigestion, type 1 below. If you've never heard that brush off, type 2. One keystroke is plenty. I'm counting how true this magazine cover still is. Stay with me. At the 21-minute mark, you'll get a pocket-sized doctor visit checklist, 10 brief questions that force any physician to address female heart disease signs. One small card could buy you 3 more decades of sunrise. Picture this: you rush to the ER with a jaw ache, fatigue, and a cold sweat, and go home with antacids. For 3 months, I plowed through journals and pestered every cardiologist I know. Here's what the research, and their answers, taught me. In 1991, Dr. Bernadine Healy coined Yentl syndrome after discovering fewer than 22% of patients in 32 heart studies were women. All the classic truck on the chest criteria were written for male bodies, so heart attacks in women were invisible by design. Fast forward to 2005. Dr. Nanette Wenger rewrote the guidelines, adding jaw pain, nausea, and crushing fatigue, the very female heart disease signs most men never feel. Then came the 2006 WISE study led by Dr. C. Noel Berry-Mers. Nearly 60% of women with mild chest pressure had microvascular damage. Standard EKGs looked fine, so thousands were tagged indigestion or anxiety, a textbook misdiagnosed heart attack. The latest AHA report, 2024, shows women still reach the cath lab 17 minutes later than men. 17 minutes, long enough for a thumb-sized patch of heart muscle to die. I measured those numbers against the night my wife, Linda, bent to fold a quilt, broke a light sweat, and felt her shoulder tighten. No crushing pain, just off. We both said, probably stress. If I had read Dr. Wenger's paper back then, Linda would have been in an ambulance 10 minutes sooner. Quick, zero-pressure check-in. If a doctor has ever brushed off odd symptoms with, "You're fine," type yes below. If that's never happened to you, type no. One short word lets us gauge how high the Yentl wall still stands. Stay close. In a few minutes, I'll show you how Linda now cuts those 17 minutes to zero with a 2-sided doctor visit checklist she keeps in her purse. One sheet of paper could be the first brick we pry from that wall. Imagine you're about to cross the Mojave at night. 2 maps lie on the dashboard, one crisp, one barely a sketch. Everyone would grab the clear map, yet for decades, women's hearts have had to navigate with the blurry one. The first person to redraw those faint lines was cardiologist Nanette Wenger. In 2005, she published a landmark circulation paper and wrote 3 new highways onto the medical chart. 1. Fleeting jaw or neck pain. 2. Sudden, unexplained exhaustion. 3. Mild nausea or indigestion. She proved these signals appear in 42% of women who suffer a myocardial infarction, but only 8% of men. When ER nurses treated those odd complaints as possible heart attack in women's symptoms, administering 160 milligrams of aspirin on arrival, in-hospital death dropped 23%. Wenger called them female heart disease signs, the private language of a woman's heart that standard textbooks had printed in faint gray. I handed Wenger's article to my wife, Linda, and to our friend Cheryl, 62. Cheryl had months of low-grade nausea. Her doctor blamed blood pressure meds. After reading, she marched back with the printout. They ran a stress echo instead of a basic EKG and found 70% microvessel blockage. 1 baby aspirin and a new treatment plan bought Cheryl this summer's vacation with her grandkids. Your turn. Of those 3 signs, which one do you notice most? Just type the first letter, J, jaw, E, exhaustion, or N, nausea. One keystroke lets newcomers in the comments see they're not alone. In a moment, we'll open the WISE study and discover why a woman can show a picture-perfect EKG while a corner of her heart is dying. When Wenger's map meets Wise's satellite view, the survival route for women gets a lot brighter. Ever driven all night with the gas light broken, only to find the engine sputtering at sunrise? That's what standard EKGs can be for women. The warning light stays dark while tiny fuel lines, our cardiac microvessels, clog mile by mile. To expose that hidden danger, cardiologist C. Noel Berrymers launched the WISE study. From 1996 to 2006, WISE tracked more than 4,000 women complaining of vague chest pressure. The findings stunned the field. 58% showed unmistakable heart attack symptoms in women, yet their major arteries looked wide open. The trouble was in the microcirculation. On early EKG and troponin tests, 83% still looked perfect, then got labeled anxiety or reflux, a textbook misdiagnosis heart attack. 5-year follow-up revealed the untreated microvessel group died at triple the rate of women who received targeted therapy. Dr. Berrymers put it bluntly, women are driving with a broken fuel gauge. When the car stalls, people ask why we didn't watch the dial. No one admits the dial wasn't built for us. I printed the WISE charts and set them beside Linda's diary. Her light sweat and right shoulder ache, those broken gauges, finally glowed neon. So what test finds microvessel disease if my EKG is clean? She asked. Our cardiologist recommended 3 steps. 1. Pharmacologic stress echo, images vessels big and small. 2. Contrast cardiac MRI, spots microscopic scarring. 3. Early low-dose aspirin plus statin calms microvascular inflammation before full rupture. 2 months later, Linda's stress echo showed macroarteries fine but microflow down 25%, her treatment plan changed, and the nightly sweats disappeared. Quick check, had you heard of cardiac microvascular disease before this video? Type yes if you had, no if you hadn't. A single word lets newcomers see how new this knowledge still is. Stick around, next we'll reveal why a 90 BPM pulse sends a man straight to the cath lab, yet a woman home with antacids. And how one small checklist can shrink that gap to 0. Close your eyes and picture 5 postcards, each stamped from a different ER. The ink is still wet, because the women who wrote them were there only weeks or months ago, all lost in the maze that hides heart attack in women's symptoms behind indigestion, anxiety, or just stress. Anne, 59, Ohio. 3 trips to the ED for gastritis. On the 4th, a junior doc ordered a cardiac MRI, her microvessels were 60% blocked. Had I known nausea plus fatigue could be cardiac, I'd have saved 4 lost years. Maria, 64, Texas. Right shoulder burn, pristine EKG. Sent home with antacids, she collapsed at 8 p.m., her son's CPR kept her alive. The chart now reads misdiagnosed heart attack. Your video gave me the words, microvascular disease. Evelyn, 47, Seattle. Standard stress test negative, but 1 flight of stairs left her breathless. She printed Dr. Wenger's article, a dobutamine stress echo showed 40% microvessel narrowing. 6 weeks of aspirin plus statin. Now she climbs 3 flights, chatting. Doris, 70, Florida. Woke drenched at midnight, thought it was indigestion. Remembered our series, chewed baby aspirin, and called 911. Troponin rising, a 95% Widowmaker stent placed in time. 181 milligrams pill and 1 video bought me birthdays 70, 71, 72. Grace, 53, New York. Jaw twinge during a Zoom call, teledoc blamed her bite. She logged the pain in our 72-hour diary, it repeated 3 nights. MRI revealed microscopic scarring. Early therapy, no heart attack ever struck. When I read these aloud to Linda, she squeezed my hand, we're not alone. Neither are you. Every comment is another thread in a safety net faster than any monitor alarm. Which story hit you hardest? Just type the name, Anne, Maria, Evelyn, Doris, or Grace. One word shows the storyteller she helped and tells new viewers they're not isolated. Stay with me, next I'll lay out the male versus female ER timeline. And the pocket-sized doctor visit checklist that made Linda's cardiologist change her treatment in 7 minutes. We're about to erase a 17-minute life and death gap. Set a timer for 17 minutes. While the seconds tick, picture 2 patients with the same heart rate and blood pressure, one man already wheeled into the cath lab, one woman still waiting while a resident rewrites her antacid prescription. When the alarm rings, the gap between those 2 hearts is etched in muscle that will never beat again. Numbers first. The 2024 American Heart Association dashboard shows men move from ER door to cath lab in an average of 49 minutes, women take 66, exactly 17 minutes longer. A 2022 JAMA cardiology study adds another twist: women who show atypical heart attack in women's symptoms, jaw pain, nausea, exhaustion, wait 12 minutes longer than women with crushing chest pain. Total, nearly half an hour of silent damage. Why the delay? Vague language, fatigue and jaw ache don't flash red on triage forms. Legacy guidelines, a normal EKG means you're fine. And there's no standard script for doctors to ask about female heart disease signs. That's why Linda carries a 1-page doctor visit checklist I built from Cardiology Consults. 7 bullet points. 1. Exact time the unusual symptom began. 2. History of high blood pressure after menopause. 3. Any 72-hour symptom diary on record. 4. Shoulder or jaw pain rating, 1 to 10. 5. Resting heart rate over 100 bpm. 6. Previous stress echo or cardiac MRI. 7. Family history of a silent heart attack in women. Linda hands this sheet to the triage nurse before answering a single question. In less than 7 minutes, the ER doctor switched from antacid orders to stat stress echo and repeat troponin. The 17-minute gap vanished. Your turn. Download the checklist from the link below, print 2 copies, laminate one for your wallet, stick the other to your phone case. At any appointment, slide it across the desk before the first question. If you've already downloaded it, type "Got it." Need the link? Type "Need" and my team will reply with the direct download. Stay with me, the next clip shows Linda using that checklist in real time. You'll see how 7 questions turn a piece of paper into heart insurance. Imagine a movie scene where the hero flashes a "get out of danger" pass at the last checkpoint. That was Linda last Tuesday morning. Her pass was the 1-page doctor visit checklist. Hidden phone camera in her blazer pocket. Midnight she slides the checklist onto the cardiologist's desk, no small talk. 0:37 the doctor spots the line, resting heart rate greater than 100 bpm, and instantly switches tone. 2:10 a.m. nurse walks in with an order for a pharmacologic stress echo. 6:45 Linda signs for an HSCRP panel and a baby aspirin script. Total appointment time, 7 minutes 15 seconds. No one said, "Let's watch it for a while." Walking out, Linda whispered, "7 minutes just erased the 17 I almost lost." In the next 48 hours, more than 1,200 people downloaded the checklist. Doris from Florida posted, printed and taped to mom's iPhone case. Grace from New York shared a story, checklist plus 72-hour diary equals peace of mind combo. If you've printed yours, snap a photo and post it with #checklistchallenge. Every picture lays another patio stone on the path to faster care for the next woman. Next week's video, Anxiety or Heart, will demo a 90-second at-home test that separates nerves, reflux, and heart attack symptoms in women on the spot. Hit the bell so you don't miss it, and if today's sheet of paper eased your worry even 1%, share this episode with one woman you care about. We can't erase the emergency room from life, but we can bend time so our hearts arrive there early, thanks to a sheet of paper thinner than a credit card.